So let us see how we give a central line. So before giving a central line, it is very important to put on a gown, a clean, sterile gown, right? And put on a cap, mask. So very important to maintain sterility while giving before giving a central line. Then put on the sterile gloves of appropriate size you want. So put on the gloves. Here is putting on the gloves. Then clean the site properly. Check the site which you want to give. Mostly preferred site is jugular, right or left. And then use an ultrasound when you give a central line. USA guided central line is is the recommendation, ultrasound guided. And before giving a central line, it is very important to clean the site properly. Okay. So is cleaning the site properly with a betadine, 10% betadine, or you can use the hand rub which we use, which is a mixture of chlorhexidine, 2%, 2.5% plus ethyl alcohol 70%. That is also can be used. That is first preferred. If it is not there, then 10% betadine we can use. Cleaning the site. Right? So he's cleaning it once more. Go it from central to peripheral in a round manner. If you have left the central, don't come it again from peripheral, because otherwise it will again become sterile. Once you're in the periphery, don't come to the central. Then you just put a sterile drip, okay, a cut sheet properly, and don't touch. The sister nearby has touched it, but don't touch it, okay? It is a very sterile technique, don't touch it, and ask the patient whether he is comfortable or not. If the sheet is small, you can use another sheet. It's best use another sheet and take out the all the things which is there in the central line pack. That is the guide wire, dilator, the needle, the central line catheter, and all the mm suture materials and all. Take it out one by one properly and keep it in the tray or in the sheet. Okay. Yes, this is the catheter. This is the dialysis catheter. We can use the central line catheter the same way. It is the same thing, and check it whether it is patent or not by flushing it with a normal line, or whether there is any leak. You can check it by doing this. Okay. After that, you check all the needles, puncture needles also. Everything you check before putting on the central line. Then take a 5 cc needle. Take local anesthesia to anesthetize the site before giving a central line, because it will cause less pain to the patients. Comfort of the patient is very important before doing any procedure. Then he is drying the area with a dry gauze. He's cleaning it with using chlorhexidine over it. Then yeah, after that apply local anesthesia, anesthetize the site. A triangle formed by the sternocleidomastoid muscle, the internal and external border, anterior and posterior border. And then after giving the local anesthesia, you have to puncture it. See, you can use, if you have ultrasound machine along with you, it is very important, the best that to use a USG machine, because nowadays the recommendation is to use a USG machine. But if you don't have, you can use the anatomical landmark as he has used. After that, puncture the site along the, in the angle which is formed by the sternocleidomastoid. You can put the needle, and also by palpating the carotid artery on one side, you can also find the internal jugular vein. So he has found the internal jugular vein. See, he is aspirating the blood. Okay, and after that, put on the guide wire very gently. He is putting on the guide wire. You can see, and then remove the needle and let the guide wire be there. Right, and then he applied a dilator. This is a small dilator. Apply it. He is dilating the area. Just put little bit, don't insert the whole dilator, just little bit to dilate only the track. This is a bigger dilator, earlier was a smaller dilator, this is a bigger dilator. He is putting it and dilate little bit because the vein is just nearby. So dilate just little bit, just to dilate the track, not the vein. Okay, if you dilate the vein, there will be bleeding, lot of bleeding. Okay, after that you put on the catheter. This is the dialysis catheter, and you put on, don't touch the tip, put the dialysis catheter inside. Prefer to touch the tip less. Put on the dialysis catheter. He's putting it on inside. Okay, inside completely, and then remove the guide wire. Okay, so he has removed the guide wire, and now he's flushing the lines, confirming the backflow of the blood and flushing the line with normal saline. So he has flushed the lines with normal saline. This is the central lumen, and the other two lumens for dialysis, that is the red one for the arterial and vein, and blue one for the vein lumen. Okay, this is the same way we give the central line, same way we give the dialysis line. Then flushed all the three lines, otherwise there might be blockage. And then fix, and then fix it. Stitch it with suture. Stitch with suture properly. Yeah, he is suturing the catheter so that the catheter remains fixed. If you don't suture the catheter properly, so it might come out, it might get dislodged, right? So it is very important to suture it properly, fix it. Okay, to fix it with a good suture, right? And after that, apply the tegaderm which is provided. Apply that tegaderm which is provided with a dialysis catheter. Don't use dynaplast. Okay, use tegaderm. Dynaplast should not be used, otherwise there will be infection in the side. You will not be able to see what is there beneath the side of catheter. So apply the diagram like this. This is the way you should give a dialysis line. This is the way you should give a central line as well. So all this whole team was there while giving the line, and patient is also okay. Thank you for everything.